on the web, and in your hands. This is MDiTV.
Is being religious good for your heart? Of course, for many people, religion is an essential part of a healthy life. But just looking at the specific scientific question of links between religious belief and activities and cardiovascular health, there have been a number of studies and proposed mechanisms supporting a positive connection. But now researchers who looked at an ethnically diverse group of participants from across the country say they did not see any evidence that those who said they were more religious scored any better on measures of cardiovascular health. Indeed, as they reported in the journal Circulation, study participants who said they were more involved in religious activities had rates of high blood pressure, high cholesterol, coronary artery disease, heart attacks, and stroke that were similar to those of people who were less religious. There were a couple of differences: less smoking and more obesity.
Kind of a wash, but I think the obesity finding was the thing that really stuck out for us, that people participating in religious activities tended to be significantly more obese. And again, that may represent an opportunity for prevention, because we might be able, through churches and other religious organizations, to perhaps implement some obesity treatment and prevention opportunities.
Dr. Donald Lloyd-Jones of Northwestern University in Chicago says that by including more than 5,000 people from Los Angeles, Chicago, Minnesota, and North Carolina with white, African American, Hispanic, and Chinese American backgrounds, this study did a better job than many others of capturing the diversity of the nation.
As always, more research needs to be done, but our findings would suggest that religiosity per se does not necessarily protect one against cardiovascular disease, which is, after all, the #1 cause of both death and disability in this country. And I think pretty much all of us are at risk.
As with any other observational study that looks at just a snapshot of people's lives, this one can only reveal whether certain measures of, in this case, religion and health tend to go together. It can't answer questions about whether religious beliefs result in better or worse health, or vice versa. While the researchers say the ethnic diversity of their study participants strengthens their findings, another researcher who has extensively studied questions of religion and health sees a potential complication. Dr. Harold Koenig at Duke University says other factors that disproportionately affect African Americans and Hispanics could muddle these study results.
So you can see that you could very easily kind of set up an artificial relationship here that would make religion, which is more common among the ethnic minorities, seem to be either unrelated or even positively related to cardiovascular disorders, which are much more prevalent in these ethnic minority groups. So what we're really seeing here is kind of a nullifying effect for the religious effect based on the ethnicity, the education level, and the low income level.
Researchers still have to sort out how these new results fit in with the findings of other studies that have concluded people who are more religious also tend to report better health. One specific question: is there a real connection between religious behavior and obesity? You can be certain there'll be more investigations of how the essential facets of religion and health reflect on each other.